Have you ever wondered if the way you sleep, on your left side, right side, on your back, or on your stomach, can affect your heart? Maybe you've heard that sleeping on a certain side is dangerous, or that there's a wrong way to sleep that puts your heart at risk. In this video, I'll explain what science actually says about sleep position and the heart, separating facts from myths. And I'll be honest with you from the first minute, because scientific honesty is what separates useful information from an exaggerated alarm. For the vast majority of people with a healthy heart, the position you sleep in does not put your heart in danger. You can sleep on whichever side is most comfortable. But there are specific situations, especially in people who already have heart problems, where position makes a difference. And there's one sleep habit that genuinely deserves attention, because it affects the heart over the long term. Let's understand all of this calmly and based on science. First, the most important truth you need to hear. If your heart is healthy, sleeping on your left side will not cause a heart problem. This is a fundamental point because there's a lot of alarmist information circulating out there, suggesting that sleeping on the left side crushes the heart or is dangerous. This is not true for healthy people. The heart is protected inside the rib cage, and the body is perfectly capable of handling different sleep positions. So first of all, rest easy. If you sleep well on your left side and have no health problems, there's no reason to change out of fear of harming your heart. If you are not yet subscribed, click now on the subscribe button and turn on the bell. Tell me in the comments where you are watching from. Now, let's look at what science actually shows about the left side. There's an interesting and well-documented phenomenon. When some people sleep on their left side, small changes occur in the heart's electrical activity, which can be observed on an electrocardiogram. This happens because when lying on the left side, the heart shifts slightly within the chest and gets closer to the chest wall. For most people, these changes are completely harmless and aren't even noticed. But some people, especially those who are more sensitive or have certain conditions, report feeling their heart beating more strongly or palpitations when lying on the left side. This doesn't mean the heart is in danger. It just means the person is perceiving the heartbeats more consciously because of the proximity to the chest wall. If this bothers you, simply sleeping on the other side resolves the discomfort. It's not a matter of danger, it's a matter of comfort. Why many people with heart problems prefer the right side? Here we enter a specific and important situation. People who have heart failure, a condition where the heart has difficulty pumping blood adequately, frequently report feeling more comfortable sleeping on their right side. There are a few explanations for this. Sleeping on the right side can reduce the sensation of palpitations and the discomfort some of these people feel on the left side. Also, for those with an enlarged heart or reduced function, the right side tends to be more comfortable. But note, this is a matter of comfort and individual preference in people who already have a diagnosed heart condition. It's not a rule that everyone should sleep on the right side. If you have heart failure, talk to your cardiologist about the best position for your specific case. The real villain of sleep position for the heart: sleeping on your back and sleep apnea. Now we reach the most important point of this video, the sleep habit that truly deserves attention. It's not sleeping on the left or right side, it's sleeping on your back, especially for those who tend to snore or have sleep apnea. When you sleep on your back, gravity causes the tongue and soft tissues of the throat to fall backward, narrowing or blocking the airways. This worsens snoring and, more importantly, aggravates obstructive sleep apnea, that condition where the person repeatedly stops breathing during the night. And here is the crucial connection with the heart. Untreated sleep apnea is a real and well-established risk factor for heart problems. It's associated with high blood pressure, arrhythmias, heart failure, and a higher risk of heart attack and stroke. So if there's a wrong way to sleep that can affect the heart over the long term, it's sleeping on your back when you have apnea. And the solution in that case is usually to sleep on your side, either side. Tell me in the comments where you are watching. Turn on the bell. The connection between sleep apnea and the heart, explained in detail. It's worth understanding why apnea is so harmful to the heart. When a person with apnea stops breathing during sleep, which can happen dozens or even hundreds of times per night, the oxygen level in the blood drops repeatedly. Each oxygen drop is a stress on the body. The heart has to work harder, blood pressure rises, and the nervous system stays in a constant state of alert. Over months and years, this repeated stress overloads the heart and blood vessels. That's why untreated apnea is linked to hypertension, arrhythmias like atrial fibrillation, heart failure, and a higher risk of cardiovascular events. The good news is that apnea is treatable. Warning signs of apnea include loud snoring, episodes where someone notices you stop breathing while sleeping, waking up choking or gasping, excessive daytime sleepiness, morning headache, and fatigue even after a full night's sleep. If you have these signs, it's well worth investigating. God bless you and give you much health. Until next time, sleep position and reflux. There's another interesting aspect of sleep position worth mentioning because it affects many people over 60, reflux. For those who suffer from reflux, sleeping on the left side usually helps reduce symptoms, while sleeping on the right side or on the back can make it worse. This has to do with the anatomy of the stomach and the position where acid tends to remain. So, interestingly, the left side, which many people fear because of the heart, is actually the best side for those with reflux. This shows how the ideal sleep position depends heavily on each person's individual conditions. A heart-related warning sign linked to sleep position that you need to know. There's a specific symptom linked to sleep position that genuinely deserves medical attention because it can be a sign of a heart problem. It's called orthopnea. It's difficulty breathing when lying down, which improves when sitting up or raising the head with pillows. If you notice you need several pillows to breathe well while sleeping, or that you wake up in the middle of the night short of breath and need to sit up to improve, this can be a sign of heart failure and deserves medical evaluation. This symptom happens because when the heart isn't pumping well, lying down causes fluid to redistribute and accumulate in the lungs, making breathing difficult. Unlike the choice between left and right side, which is a matter of comfort, orthopnea is a signal the body gives that should not be ignored. So, what's the best sleep position? The honest answer is, it depends on you. For most healthy people, the best position is simply the most comfortable one. There's no need to force a specific position out of fear for the heart. But here are some guidelines based on individual situations. If you snore or have apnea, avoid sleeping on your back and prefer sleeping on your side. If you have reflux, the left side tends to help. If you have heart failure and feel uncomfortable on the left side, the right side or a more elevated position may be better. If you feel palpitations on the left side but are healthy, simply sleep on the other side without worry. And if you need several pillows to breathe or wake up gasping, see a doctor. God bless you and give you much health. Until next time. The most common myths about sleep and the heart cleared up. Let's debunk some myths. Myth number 1. Sleeping on the left side crushes the heart and is dangerous. False. For healthy people, sleeping on the left side is completely safe. Myth number 2. There's a single correct position for everyone to sleep in. False. The ideal position depends on individual conditions: reflux, apnea, pre-existing heart problems. Myth number 3. If I feel my heart beating when lying on my left side, it's a sign of disease. Generally false. Most of the time, it's just a more conscious perception of the heartbeats. Myth number 4. Sleeping on your back is the healthiest position. It depends. For those without apnea or snoring, it can be comfortable, but for those with these problems, sleeping on the back makes the situation worse. The important thing is to separate exaggerated alarm from real information, and the real information is reassuring for most people. Other sleep habits that really matter for the heart, more important than worrying excessively about which side you sleep on, is taking care of the overall quality of your sleep, because poor sleep affects the heart. Chronically sleeping few hours is associated with a higher risk of high blood pressure and heart problems. Sleep deprivation increases stress hormones and inflammation. So, ensuring 7 to 8 hours of quality sleep, keeping regular schedules, avoiding screens and caffeine at night, and creating a calm environment for sleeping are measures that protect the heart far more than choosing between the left and right side. Restorative sleep is a pillar of cardiovascular health, along with diet, physical activity, and controlling blood pressure and sugar. Let's go deeper into apnea because it's the most important point for heart health. Many people live for years with sleep apnea without knowing it, thinking snoring is just a nuisance for whoever sleeps next to them. But apnea is much more than snoring. During sleep, the throat muscles relax, and in some people, they relax too much, causing the airways to narrow or close completely. The person stops breathing for a few seconds, oxygen drops, and the brain reacts by briefly waking them to resume breathing, often without them noticing. This cycle repeats all night, fragmenting sleep and overloading the heart. Sleeping on the back makes this worse. That's why changing position, sleeping on the side, is one of the first recommendations for those with mild apnea. But proper treatment may involve devices like CPAP, which keeps the airways open, and evaluation by a sleep medicine specialist. Treating apnea not only improves sleep, but protects the heart from serious long-term complications. If you snore loudly and feel tired during the day, don't ignore it. It could be apnea, and investigating can make a big difference for your heart's health. God bless you and give you much health. Until next time. Frequently asked questions about sleep position and the heart. Does sleeping on the left side harm the heart? For healthy people, no. It can cause a more conscious perception of heartbeats in some people, but that's comfort, not danger. Which side should someone with heart failure sleep on? Generally, the right side is more comfortable, but it varies. The ideal is to talk with the cardiologist. Is sleeping on your back dangerous? For those with apnea or snoring, yes, it can worsen the situation. For those without these problems, it's usually comfortable. Is feeling your heart beat when lying on the left side a sign of disease? Generally, no. It's just a more conscious perception of the heartbeats. I need several pillows to breathe while sleeping. Is that normal? Not necessarily. It can be a sign of heart failure called orthopnea, and it deserves medical evaluation. What's the best sleep position? The most comfortable one for you, respecting your individual conditions like reflux, apnea, or heart problems. The importance of not panicking over alarmist information. We live in an era where a lot of health information circulates in an exaggerated and frightening way, especially in videos and social media. Titles saying you're in danger if you sleep a certain way grab attention, but don't always reflect scientific reality. The truth about sleep position and the heart is, for the most part, reassuring. Healthy people can sleep however they prefer. What really matters for the heart isn't the side you lie on, but taking care of apnea if you have it, maintaining quality sleep, controlling blood pressure and sugar, eating well, staying active, and getting medical follow-up. Don't live in fear of sleeping on the wrong side. Live with attention to the real signals the body gives, and with the care that actually makes a difference. Correct information frees you from unnecessary fear and directs attention to what matters. A summary to take with you. The central message of this video is reassuring and honest. For most people with a healthy heart, sleep position does not put the heart in danger. Sleeping on the left side is not dangerous for healthy people. People with heart failure often prefer the right side for comfort. Those with reflux benefit from the left side. And the real sleep habit that affects the heart over the long term is sleeping on your back when you have sleep apnea, because untreated apnea is a real cardiovascular risk factor. Stay alert to the sign of orthopnea, difficulty breathing while lying down, which deserves medical evaluation. And remember that overall sleep quality matters more for the heart than the side you sleep on. God bless you and give you much health. Until next time. A practical observation guide to take to your doctor. If you want to better understand your situation before an appointment, observe a few points. Do you snore loudly? Or has someone noticed you stop breathing while sleeping? Do you wake up tired even after sleeping several hours? Do you feel excessive sleepiness during the day? Do you need more than one pillow to breathe well while lying down? Do you wake up in the middle of the night short of breath and need to sit up? Do you feel palpitations when lying down, and do they improve when you change position? Do you have reflux that worsens when lying down? The answers to these questions help the doctor understand whether there's something that deserves investigation, like apnea or a heart sign, or whether it's just a matter of comfort. Take these observations to your appointment because they make the evaluation faster and more precise. Why sleep quality matters as much for the heart as position. While many people worry about which side they sleep on, the factor that really makes a difference for the heart is sleeping well, sufficiently, and restoratively. Studies show that people who chronically sleep less than 6 hours per night have a higher risk of high blood pressure, coronary disease, and other cardiovascular problems. Sleep is when the body recovers, blood pressure naturally decreases, and the heart rests from the day's effort. When sleep is poor or insufficient, that recovery doesn't happen properly, and the heart becomes overloaded over time. That's why creating good sleep habits is a direct investment in heart health. Keeping regular schedules, avoiding heavy meals and alcohol near bedtime, reducing screens at night, keeping the room dark and quiet, and treating conditions that disrupt sleep, like apnea. In the United States, sleep apnea is widely underdiagnosed, and Medicare and most health plans cover evaluation of these conditions. God bless you and give you much health. Until next time. A final reflection on listening to your body with balance. Sleep position is a good example of how we need balance when caring for our health. On one hand, we shouldn't ignore real signals the body gives, like difficulty breathing while lying down or snoring with breathing pauses. On the other hand, we shouldn't live in fear of every small detail, like which side we lie on, when science shows that this isn't dangerous for healthy people. The balance lies in knowing your own body, paying attention to the signals that really matter, and seeking medical guidance when necessary, without falling into alarmism or neglect. Sleep comfortably, take care of your sleep quality, treat apnea if you have it, and see a doctor if you notice warning signs. Your heart is grateful not for the position you sleep in, but for the conscious and balanced care you give your health as a whole. So rest easy tonight. If you're healthy, the side you sleep on is your choice, and the most important thing you can do for your heart is to sleep well, breathe well, and stay attentive to the signs that truly matter. God bless you and give you much health. Until next time with more evidence-based health information. Take good care of yourself and your heart. A reassuring and science-based message. Sleep comfortably without fear of the wrong side. Take care of what really matters. Sleep quality, treating apnea if you have it, and attention to warning signs like difficulty breathing while lying down. Listen to your body with balance, without alarmism and without neglect. God bless you and give you much health. Until next time. If this video reassured you or helped you, share it with someone who worries about their sleep position. Take care of yourself and those you love, with correct information and peace of mind. God bless you and give you much health and nights of restorative sleep. Until soon. Sleep well, sleep peacefully, and wake up with energy to live. Your heart and your body are grateful for balanced care. Don't live in fear of the side you lie on. Live with attention to what truly matters. Peace of mind is also health. God bless you and give you much health. Until next time with more health science. Good nights of sleep and good days of health to you and your family. Remember, sleep comfortably. Address apnea if you have it, and consult a doctor at the first warning signs. Your health is your greatest treasure. Care for it with wisdom, without alarmism and without neglect. God bless you. Until next time, take very good care of yourself. Rest tonight knowing the truth. If you're healthy, the side you sleep on is your choice. Sleep well, breathe well, and stay attentive to the signals that truly matter. God bless you and give you much health. Until next time, Amen. Sleep on the side that gives you peace. Address what matters, and live calmly. A good night's rest is one of the best gifts you can give your heart. God bless you and give you much health. Until next time, rest well, take care of your sleep, your heart, and your peace of mind. They are silent pillars of your daily well-being. Rest well tonight and wake up tomorrow with more awareness of your body. God bless you and give you much health. Until next time with more health topics for you. Health and good rest to you and your loved ones. Starting today, listen to your body's signals with balance, neither alarm nor neglect. God bless you and give you much health. Until next time, take good care. Your well-being is built on the everyday care you give yourself. Sleep well, breathe well, and stay attentive. God bless you and give you much health and restful nights. Until next time. Amen. Remember the central truth. For a healthy heart, the sleep position is your comfort, not your danger. Care for the things that truly matter. God bless you and give you much health. Until next time, rest peacefully. Good health and peaceful sleep to you. Until next time, take very good care of yourself. God bless you. Sleep well and live well. Until next time. Amen. Take care and rest with peace tonight. God bless you. Until soon. Rest well. Goodbye. Be well. Amen.